My name is Dr. Mario Rosenberg. I am a gastroenterologist and I take care of digestive disease problems. I have been associated with the Clinica Medica for the past 10 to 15 years. I take care of all the digestive problems as well as liver or gallbladder problems. We perform diagnostic procedures like colonoscopy and endoscopy for the prevention of cancer or for the treatment of symptoms that they are related to the digestive tract. So we perform diagnostic colonoscopies. Diagnostic colonoscopy is a routine test that is recommended to be done on everyone at the age of 45. If the test is perfectly normal, then you repeat it every 10 years. But obviously, if you have symptoms like diarrhea, constipation, or intermittent rectal bleeding, or you have a family history of carcinoma of the colon, you have to have a colonoscopy for the detection and prevention of disease. The colonoscopy is a very simple procedure and it's a routine procedure that is being done everywhere. It consists in a preparation that has to be very careful, that consists on taking liquids the day before the procedure, no solid food, and the day of the procedure you cannot drive. Somebody has to drive you because we're going to give you some sedation so you have a pleasant procedure. During the procedure, that takes 10 to 15 minutes, we insert a scope through the rectum and we examine all the large intestine. If the test is normal, then you come back in 10 years. If the test is abnormal and we found some abnormalities like inflammatory process or a polyp, which is a growth, during the procedure we remove it and we take biopsies. After the procedure, you can renew your normal life. You can go back to work the next day. Well, after the procedure, it's obvious that the patient cannot drive because we're going to give you some sedation. And in spite of the fact that the patient is going to be awake, we don't want them to drive. Certainly that day, we don't recommend them to go back to work. After the procedure, the patient can eat whatever they please to eat. There are no limitations. And 12 hours after the procedure, they can go back to a normal life. We advise the patient to return in 1 week for the results of the procedure. In spite of the fact that after the procedure, we tell the patient what we found, many of patients, since they have been under sedation, they forget what the doctor tells them. So we give them an appointment in 7 days to come back for the results. Well, it's very important to do a colonoscopy because it's a diagnostic test. For unknown reason, we Hispanics have a higher predominance of cancer of the colon. We have more cancer of the colon than the rest of the population in the United States. We don't know the causes, but we know that this is true and is well documented in the literature. So at the age of 45, or if you have symptoms before that age, the importance of doing a colonoscopy is, needless to say, that it's important to do a colonoscopy. It is a diagnostic procedure, and cancer of the colon is totally curable if it's detected in an early stage. Well, I thank you. The clinic, fortunately, is open 24 hours. I am here to take care of you. So look for me, Dr. Mario Rosenberg. Fortunately, we have a surgical center in this clinic, and we have the equipment that is necessary to perform any diagnostic procedure. We have the state-of-the-art endoscopes, so the technology that is necessary to diagnose polyps or cancer of the colon.